Madam Speaker, the Acting Prime Minister, Leader of the Opposition, I rise in support of the 2016 budget, and I would say it's actually a real thumbs-up budget for all the people of this country. In doing so, I must congratulate the Minister for Finance and his team, because this budget builds on the considerable progress we have seen during this first year of the Fiji First government. It continues to do that, and it is a budget that continues the surge to achieve our vision of building a better Fiji for everybody that lives in this country today and those that will follow in the future. It is a budget that is firmly focused on building the basis of sustained development that will continue to go on. It sets out to achieve development targets and at the same time is hugely progressive in looking after those that are struggling the most in this country. There have been a number of comments from the other side stating that the changes introduced do not look after those at the bottom of the socioeconomic pile. I think these comments reflect a failure to fully understand the full budget and the other measures that have been put in place. Overall, obviously, the impact of this budget will be on reducing cost of living, since VAT has been reduced on all things. Yes, VAT has been introduced for some of the basic foodstuffs, but overall, the impact will still be to the advantage of those who need assistance because the overall cost of living has decreased. At the same time, as has been mentioned before, the reduction in duty in many items that people use on a day-to-day basis. A lot of these items are used people at the lowest socioeconomic levels. Those have also been reduced. And I think the key point to take into account when looking at the impact of the budget is to notice that where assistance is given, it is targeted. It is targeted at those that need the assistance most. If you look at the areas, some of the areas in which the targeted assistance has been provided, this year we have seen that there's an extension of the free medicine. That is obviously going to have an impact on those who need that assistance. Over the past few years, we've had the assistance in free bus fare, tuition. We've had the establishment of national minimum wages recently, the increase of national minimum wages. There used to be people around this country who used to work for 50 cents an hour. Now those lives of those people have been uplifted. Now they get a salary of at least $2.33. So when you're looking at the impact of the budget, you also need to look at it in light of all of the other policies that have been put in place by government. Assistance to those who are running small and micro enterprises has been elaborated by the Honorable Choir, making a huge difference in their lives, people. Social welfare payments, assistance in water and power. All of these things taken in totality is lifting the lives of everybody in this country, especially the most marginalized and those that need that assistance. And on that ground, I congratulate the Minister for Finance and his team for coming up with a well-thought-out budget with targeted interventions to assist those that are least well off in our country. Time and time again, when comments are made on the budget, there's a deliberate failure to look at the impact of everything that government has put in place. This budget plus all of the other initiatives and policies that are in place. In terms of health overall, this budget once again reflects the importance that government attaches to health. The health of our people continues to be a major focus of the Fiji First government. This is reflected in the increase of 11.3 million for the 2016 budget. And I think if you look at the budget, one of the most important aspect of this budget, the most important aspect of health is having enough people, adequately trained people to be able to deliver the service. And that is reflected in the budget. In the 2016 budget of 280 million, 44% of this budget is focused on making sure that we have adequate human resources to be able to provide health services. That comprises about 130 million. There is a capital expenditure of around 53.8 million, which comprises 18.5% of this budget. Other operational costs, which will allow us to run the activities that we need to do to have an impact on people's life, amount to around 95 million or 32% of the budget, Madam Speaker. And overall, and VAT also takes up a portion of 3.7%. So there is adequate money that is being provided this year to allow us to be able to deliver the kind of programs that we need to do for our people. Over the years, since the advent of the Bainimarama government and now the Fiji First government, there has been a strong focus on the decentralization of many services in the health system. Initially, a lot of services were centralized in the large hospitals. Over the years, there's been a strong focus on taking these services out closer to people so that they do not have to come to the center, that the services is taken out to them. This strong focus on decentralization has continued and will continue. Over the past 4 years, we've seen the decentralization of general outpatients, especially in Suva. That drive will continue. We hope to continue that drive across to Lautoka and Lambasa and to the other areas of Fiji so that services can be taken down to people. We've also seen the decentralization of mental health services. Initially, they used to be provided only in St. Giles. Now they are being taken out to the divisions and the subdivisions, so services is brought closer to people. Other services are now also beginning to be decentralized. These include facilities, services in ultrasound, and other specialized clinical services. These will continue to be taken out to the peripheries. This year, as part of the overall decentralization, and also as part of trying to ensure that we have stronger execution of our policies and our plans, we are focusing on enhancing efficiency and speed of service. The management of the budget is also being decentralized. That is something that is very new for the ministry. This year we'll see the commencement of a process that will ultimately see each major hospital and each of the divisions take responsibility for their own affairs in terms of managing the budget. The 3 major hospitals and the 2 specialist hospitals, St. Giles and Tamabo Tumi, have now been given specific budgets. Each of the 4 divisions have been provided a specific budget, and their subdivisional hospitals will actively manage their health centers, nursing stations, and the related public health activities. This will enhance transparency, ownership, accountability, and speed of performance. When you decentralize, the one thing that you do get is speed and efficiency in getting things done on time. The ministry will continue the trend of outsourcing non-core activities such as security services, cleaning services, mortuary services, and in the future, kitchen services also, the production of food, so that our people can focus on their core activity of keeping the healthy and trying to treat those that require assistance. While we have continued to develop our facilities and have improved the pool of specialists that we now have, especially with the CWM, and I've been glad to see over the past few years we've been able to develop our pool of surgeons and specialists. We still have major challenges in the area of subspecialist care. And for this, our government will continue to try to assist the people in Fiji that need services that cannot be provided in Fiji but need to go offshore. A sum of 1.3 million has been set aside for those that need this overseas medical consultation. Applicants will still need to meet the criteria that they need to meet, but they have access to this kind of assistance that is provided in this budget. One of the things that we're very fortunate about in Fiji is that we get a lot of people who come from offshore and donate their time, free of charge in a lot of cases, to provide specialist surgical services in Fiji. These include groups like Friends of Fiji, Loloma Foundation, the Seventh-day Adventist. And in this budget, we have provided 500,000 to assist these teams when they come across to Fiji to deliver the service to our people. We also do not forget those in our rural and maritime locations who require urgent medical evacuation to either Suva, Lautoka, or Lambasa. To make sure that they can access this service, the government has now provided a sum of 2.2 million that has been set aside for medical evacuation. We've also improved the process around this, and referral guidelines to manage these evacuations have been put in place to deal with the problems that were faced in the past. Health is something that cannot be addressed by the Ministry of Health alone. It requires collaboration with a lot of other agencies. Grants will continue to be provided for these agencies, such as the Chanel Home of Compassion, Father Law Home, the Reproduction and Family Health Association, St. John Association, and Empower Pacific. A new grant is to be provided to Project Heaven to continue screening of school children for hearing and visual problems so that they can be referred as quickly as possible to specialists who will then take on the challenge of looking after them. The major component of the increase in the budget this year in the Ministry of Health is in relation to the additional positions for doctors and nurses that have been provided in 2016. In 2016, an additional 150 doctor positions and 200 nursing positions have been established. These are designed to lift the number of personnel and thereby improve the level of service. We hope to be distributing these doctors to our major hospitals, where CWM will be receiving 36 additional doctors and 20 nurses. Lautoka will be getting 30 new doctors and 15 nurses. Lambasa, 24 doctors and 15 nurses. St. Giles Hospital and Tamavua Tumi will get an additional 5 nurses each. Our Central Division will receive an additional 10 doctors and 25 nurses. Eastern Division, 10 doctors and 25 nurses. Western Division, 20 doctors and 50 nurses. Northern Division, 20 doctors and 40 nurses. All of this is designed to move closer to our target of a ratio of 1 doctor per 1,000 people and 4 nurses for every 1,000 people. We still have some way to go to achieve that particular target, but I hope to be able to achieve it in the foreseeable future. $1 million has been set aside for training and development of our medical people, of our medical staff. This is absolutely critical. There will be a strong focus on developing our local medical personnel who wish to specialize. Money is being made available for that in the training programs. At the same time, we will look to tap into those who have been able to score scholarships to undergo training for in countries such as China, Cuba, and Georgia. Efforts will continue to recruit from other countries. We will continue to have issues of retaining staff, and a number of measures are being put in place to address this. Where necessary, those staff with specialist skills who are about to retire will be retained so we can provide their services to the people that need them. We are also developing career paths for those who may wish to take up specialist nursing positions. This will ensure that we maintain them in the areas in which their expertise is required. There will be a development of this in nursing and other areas where such developmental career progression is required. We will continue to emphasize the values of the ministry and the importance of customer service, since this is an area that we receive most of our complaints about. The values that we have in the ministry have now been incorporated into the performance management system for staff, and all staff will be evaluated against their ability to live up to the values and to be able to exemplify these values in their behavior when they meet with our customers, for our patients that come to our hospitals and our health centers. The other area that we are resolving to address very strongly again this year is our emphasis on leadership at all levels within the Ministry of Health. We have introduced in 2015 a leadership models that looks at 6 different areas, and this will be strengthened right across the ministry, because I believe that one of the elements of poor service in the past has been the weak leadership that exists at different levels. That's why one of the reasons that we've been talking about in the civil service reform, to bring in stronger leadership to allow us to be able to provide more efficient and more effective service. Capital projects are always an important part of the Ministry of Health. Government will continue to invest heavily into physical resources in 2016. In 2015, as has been mentioned by the Minister of Finance, issues were faced in getting all the capital projects up and running as required. Delays happened for a multitude of reasons. In his budget address, the Minister of Finance has pointed out that in 2016, the manner in which capital projects are managed will change. There will be a focus on removing the bottlenecks, on making processes more efficient without compromising on quality. My ministry really looks forward to this. We look forward to a time in which we will be able to focus on our core activities, a time in which we will have a central agency which builds for us the kind of facilities that our medical and health people require. This will allow us in health to focus on what we need to do, and that, as I mentioned before, is to keep those that are well, to keep them well, and to heal the sick and the deceased. Our major projects in 2016 will include the completion of the new Bar Hospital that has commenced this year. An investment of 21 million has been set aside for this work. Work on this project commenced this year and has been progressing very well. Land for the new Nakasi and new Naulu Health Center was secured this year, and civil works has commenced this month on the development of this facility. An additional investment of 3.3 million has been made available to make sure that this facility can come online in 2016. This will have the establishment of this facility will allow us to provide better health services to the people that live in the general Naulu, Nakasi, Wainimbuka area, a total of around 22,000 people, and it will also ease pressure on the CWM and Nosori hospitals, both of which are always under extreme pressure. There have been a number of comments that have been made in the House about the status of hospitals and health facilities around Fiji, the need to keep repairing them and upgrading them. In this year's budget, we have set aside $3 million for the upgrade and maintenance of our major hospitals and the related quarters in which people live. We hope that this will be able to improve the facilities that are there to allow us to provide better service to people. It's not only for the urban hospitals, but also for the health centers and nursing stations all around Fiji. We expect the new Rotuma Hospital, which has been under construction this year, to be completed in 2016 for an additional 2 million. Initial work on the new Nosori Hospital will continue in 2016 to complete in 2018. A sum of 1.3 million has been set aside for the initial work on the new CWM maternity unit of 200 beds, targeted for 28 completion. And the new Lotoka Emergency Department and Operating Theatre that commenced this year will be completed next year. A sum of 1.8 million has been set aside for that, and 1.3 million for the completion of the KRC Subdivision Hospital. For Navua, we will complete the fencing, the landscaping, and the stormwater drainage for $500,000. We also note that there are other health facilities, not yet for Ngalua, but for Navua. We also note that there are other health facilities that will be dealt with by the Ministry of Regional Development. There's a lot of, for capital purchases, government will be investing in ICT infrastructure network, equipment for urban hospitals. This is non-medical equipment, around $500,000. Equipment for health and nursing stations, $800,000. Dental equipment, $489,000. Biomedical equipment, a total of 11.9 million that includes $3 million for the new Bar Hospital. Public health. In Fiji, we are well versed with the challenges that face us. We often hear of the problems of NCDs and communicable diseases. And for this year, in the area of public health, a budget of $6 million has been provided for public health. This will be utilized by the team together with the national advisors and their team. The current expenditure patterns for health in Fiji are such that our spending is still heavily oriented towards secondary and curative services. We will still maintain this, and we welcome the introduction of incentives for those that wish to build new private hospitals and other facilities. We believe that this will help develop avenues for medical tourism into this country, and this will also relieve some of the pressure on our public facilities. However, with the onset of NCDs, the need for a focus on wellness will become stronger. In response to the question by the Shadow Finance Minister, a proportion of the levies for the tobacco taxation are added to the NCD prevention and control budget, thereby increasing the NCD allocation in 2015 and 2016. In the future 5 years, we will begin a stronger emphasis on prevention, an emphasis on primary health and public health. There will be a stronger focus on keeping the healthy healthy. This will require action across different sectors, and we will also build upon the measures we already have in place in areas such as taxation on alcohol and tobacco and the excise tax on sugar-sweetened beverages. Our 3 major hospitals at CWM, Lotoka and Lambasa, together with the 2 specialist hospitals, Tamabo, Tumi and St. Giles, are critical in providing curative services to our people. Together, they have a budget of more than $93 million. They will continue to function as the mainstay of medical services within this country. In the area of medicines and biomedical equipment, the Fiji Pharmaceutical and Biomedical Services Center is the centralized procurement center for the ministry. It purchases all our biomedical equipment and consumables. It has been provided a budget of 57.1 million this year. Every year, the challenge has been to ensure that medical equipment is provided as and when needed, and that medicines are available when needed. Over this year, some initial strategies have been put in place to address the issue of stockouts. Overall, however, more needs to be done on this. The other area that there will continue to be a strong focus in 2016, Madam Speaker, is that we will continue to have a strong focus on quality management across the whole of the ministry. This has started with a renewed program in housekeeping, and now we will be strengthening our focus on the Service Excellence Awards framework as a basis on which to provide service within the country. The ministry has also entered into a collaborative approach with FERCA to improve the key processes that we have within the ministry. There has been one question that was asked in relation to Sayadri and the services that they will provide. I'd just like to say that the agreement with Sayadri is still in place. We, however, are reviewing with our medical doctors whether the kind of service that can be provided, when we used to have the back of the Sayadri hospital, now that it has changed, once the doctors agree, if the doctors believe that we continue to have that service, we will continue to provide the service. If we believe, however, that we need to focus on just expatriating people across to facilities in India, that is also what we will continue to do. In closing, Madam Speaker, I would like to say that I believe that this budget is a budget for all the people of Fiji. It set aside, it is, for us in health, it provides the basis for us to be able to provide health services to our people, and it's a people's budget, and I commend the budget to this House.